Namaste to all. I'm Om Prakash, infertility reversal coach, helping people to get liberty from infertility. In this video, I'm going to present you the reasons, especially for infertility. And the reason why I'm making this video is it's very simple. You wanted to travel New Delhi from Mumbai, but you get into the flight at Mumbai, which is going towards Chennai. So obviously you will not reach the destination. Why? Because you have got into the wrong flight which cannot take you to your destination. So similarly, when you are traveling on the journey of infertility, you should know basically what is the reason behind your infertility journey. So once you are clear with your journey, then you can start with your journey. Then there is a greater chance of you reaching to your destination. So that is a basic reason, my dear friends. So here, education, your profession, these all are immaterial what exactly you are doing. You should have a clarity, you should have knowledge about the reasons for your infertility. And the reasons are numerous, which I can't put it in one video. That is the reason I'm making this video as a 3 parts. So in the first part, I'm going to give you 1 to 5. Second part, I'm going to give you 6 to 10. And third part, I'm going to give you 11 to 15. So here comes the first part. In this first part, I'm going to give you 5 reasons. Now, among the 5 reasons, here comes the first reason, that is ovulation disorders. So ovulation disorders are again into many categories. So number 1 is PCOD or PCOS. It is called polycystic ovarian syndrome or polycystic ovarian disorder. So here it is especially characterized of presence of so many cysts in the ovary, which will disturb the menstrual cycle and proper ovulation. And this is also caused because of more production of androgen hormones. Estrogen hormones are responsible for female sexual organ development and androgen are for male. So in this scenario, there will be more male hormones in a female. Number 2 is hypothalamus dysfunction. So in our brain, hypothalamus is a part which is responsible to produce hormones which is related to female sexual organs or female sexual organ growth. So if there is a disturbance in that, then the proper hormonal production will not happen, which will disturb the ovulation. Number 3 is thyroid dysfunction. Again, it is 2 types: hypothyroid, hyperthyroid. Hypothyroid is production of more thyroid hormone, and hyperthyroid is production of less thyroid hormone. Either way, which will disturb the ovulation and also irregular menstrual cycle. Here comes with the second factor, that is a tubal factor. So here, the first one in this tubal factor is fallopian tubes are completely blocked or partially blocked. So this will disturb either travel of egg cell or sperm cell or zygote to travel from fallopian tube to ovary or ovary to fallopian tube, either of the way. So end of the day, it will disturb the conjugation or fertilization. Number 2 is pelvic inflammatory diseases, usually which happens to unsafe or sexually transmitted infection, which will create a lot of inflammation, again which will disturb the conjugation or formation or ovulation. Number 3 is tubular adhesion or scarring. So there will be some kind of a gummy substance which is produced on the walls of fallopian tubes, which will disturb again free moving of egg cell, sperm cell or zygote. It will stick onto the walls. Or there will be some scars which are formed due to the previous surgeries, which also will disturb the free flow of egg cell, sperm cell or zygote. Here comes we with presenting of reason number 3, that is a male factor. So coming to the male factor, number 1 is a low sperm count, and the entire sperm, at least there should be 40% of the cells which is required for healthy fertilization, proper fertilization. Anything less than 40 will not allow for a proper fertilization. Number two is motility. Though we have enough number of sperm cells, again there should be motility is more important, because if they are not properly moving, they can't reach, they can't travel to the egg cell, and don't go for conjugation or fertilization, and ultimately the zygote will not happen. Number three is the morphology of the sperm cell. It is very crucial, especially the sperm cell. Two parts are very important. Number one is head, shape of the head, and the tail. So head should be in a proper position so that it can penetrate, enter into the egg cell, so that it can help for fertilization and forming zygote. Number two is the tail of the sperm cell. If the tail is a proper in shape, strong enough so that the sperm can swim across to reach the egg, and ultimately results in the formation of zygote. If any one or both are missing, then it's very difficult to get zygote. Now coming to the number four, the reasons of a male factors is erectile dysfunction. So because of so many reasons, male are not getting a strong enough erection which can deposit the sperm cells into the ovule during the intercourse. Here comes to present with me the fourth reason, that is uterine or cervix abnormalities. So in that, again we call uterine fibroids. So it is just like what I can say in a layman language, like a heavy speed breakers on a road. Alright, there should be small speed breakers on a road which can control the speed of the vehicle, but if the speed breakers are heavy, it will be very difficult for the moving of the vehicle. So same way, on the inner sides of the ovary, there will be some fibroid growths which will disturb the passage, and also implantation of the zygote in inner wall of the ovary. Now coming to the number two is uterine polyps. It is also just like a small shape, not as big as fibroids, which also disturb the implantation of zygote in the ovary. Now number three is cervical structure. It should be a proper. If it is not proper, then again it also disturb the free movement of the egg cell or sperm cell, and it cannot allow to sperm cells enter into the ovary. Now here comes me to the present number five reason, that is age related factor. So coming to the first one, female age factors, so it is inversely proportional. So basically at the time of birth, the female will come with a finite number of egg cells. As the age grows, this number of egg cells will get decreased. So that is the reason I told inversely proportional. More the age, less number of the egg cells, and less chances of getting fertilization. Number two is a male age related factor. So unlike a female, male can produce the sperm cells throughout their lifetime, but as the age grows, the quality and quantity of the sperm cells will get decreased, and especially at the higher ages, there is a great chance of damaging of the DNA of the sperm cell. Now number three is increased risk. So when a couple going for pregnancy at a higher age, there are a lot of risks involved. That is gestational diabetes, preterm birth, or low weight baby birth. So these are the few reasons, a few factors which will influence the pregnancy if the couple are going for pregnancy at a higher age. So here comes presenting me the first five reasons for infertility. So go through it very carefully and know yourself what exactly the reason, and start treatment. So I wish you all the best for your journey to win the war against infertility. If still you wanted to get a one-on-one 10 minutes complimentary call without any hesitation, just click the link which is available in the description. Looking forward to see you in one-on-one Zoom call. Thank you.